Welcome. My name is Katherine Jones, and I present to you Difficulties in Health Education, Experience with Children Amidst a Pandemic. Practice Immersion 2 Children and Youth is the only pediatrics course that student occupational therapists receive during their time at ATSU. In other occupational therapy, or OT, courses with a focus on adults, students are given the opportunity to practice their learned skills on each other or on a standardized patient. In a typical university context, it can be difficult to find opportunities for student occupational therapists to access children. But in a global pandemic, it is nearly impossible. As stay-at-home orders and safety precautions became the norm, many families of children with special needs were without therapies that were viewed as essential to their skill development. In addition, the pandemic stopped all pediatric patient care opportunities for OT students at ATSU. Prior to March 2020, teletherapy was not an option for Arizona OTs. In response to the global pandemic, in lieu of in-person visits, an emergency executive order from the governor expanded telehealth to include occupational therapy. Telehealth started to become one of the primary ways pediatric occupational therapists in all settings were able to continue to offer safe patient care. In fall 2020, I bridged the gap for students having access to children by developing a pediatric telehealth assignment that allowed OT students to work with actual children and not just simulated video cases. Students developed a 30-minute treatment plan carried out via video conferencing. In their sessions, the students adapted activities in the moment based on the child's response and developed insight into themselves as OTs and within the pediatric OT process. This assignment was also seminal in teaching students about a truly emerging area of practice just months after licensed OTs were given the ability to complete telehealth visits for the very first time. OTs have excellent observation and clinical reasoning skills, which are developed in our program through patient interaction, and this innovation targeted those skills. Furthermore, pediatric OT is fun, but adults often need to learn how to play. This assignment offered the students just that. This innovation was inspired by my OT colleagues working tirelessly during the pandemic. I supported OTs in the transition from adult care to pediatrics. I watched individuals panic in not knowing how they would support their families if they could not offer direct patient care. I knew that adding a teletherapy component to the pediatrics course would not only introduce students to an emerging area of practice, but also solve the issue of child access within patient care during the pandemic. This innovation required the research of legislature and best practice for teletherapy. The research was scarce and much effort was needed in the way of pediatrics and occupational therapy. In addition, there was trial and error on my part in designing the assignment to align with the objectives of the course and to obtain the effect of improved clinical reasoning and observation skills. The cost of implementation was virtually priceless because of the learning that resulted, unless you take into account the hours of time spent on my part. Replicating this innovation would be highly achievable for others wishing to implement telehealth practice and education into a course. Those impacted by this innovation were OT students, children receiving telehealth, and the future clients. The OT students were able to practice patient care and learn new skills within an emerging area of practice. During the pandemic, many children became at risk for mental health problems, and I would like to believe that the student teletherapy sessions provided a reprieve from the isolation that the children who participated may have been feeling. The OT students will take this learning into practice, which will affect their future clients. In their reflections on the assignment, students commented on the growth they saw in themselves as an OT and their realization of how therapists command a session while making it fun for children. Students also were amazed at how a session plan can require quick changes in the moment and that they were able to achieve those changes. This is something that they would not have come away with without this assignment. This innovation aligned with 4 out of 5 core professional attributes. OT students improved their critical thinking skills as they navigated designing, implementing, and updating their sessions as they happened. They were given naturalistic opportunities to address cultural proficiency by working with child, siblings, caregivers, and extended family, and they went into these sessions without knowing what would happen and then had to react by adapting their own behavior and responses. Because this innovation prepared them for an emerging area of practice, students will now be able to advocate for the expanded teletherapy services for OT. They also come away with a feeling of responsibility to represent their profession well and through the quality of their work and the behavior with their clients and families. And they learn the value of consent for participation and the importance of confidentiality. Finally, they improve their interpersonal skills of communication, active listening, and questioning and conflict management by working with children and families who are at the core of pediatric OT services, as well as their OT colleagues to develop the initial plan.